Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, we've got a packed show today, some big shifts in staffing mandates, updates on infection control, and even a new push to support family caregivers.
Right? And we'll also touch on a new Florida law that's changing what goes into admissions packets for assisted living and why it could make a big difference.
Plus, there's a fresh look at how we approach research for older adults, and a CDC update that could impact how communities handle COVID vaccinations.
So whether you're managing a community, working on the clinical side, or just trying to stay ahead of policy changes, there's something here for you.
Let's get into it.
So first up, big news from McKnight's long-term care news about the federal staffing mandate.
Yeah, a judge just struck down the part of the CMS rule that required nursing homes to have a registered nurse on site 24/7.
Which is huge, right? That was one of the most controversial parts of the mandate, especially for rural communities that were already struggling to meet the requirements.
Exactly. Operators have been raising concerns about workforce shortages and financial feasibility since the mandate was first announced. And now, the court's saying CMS may have overstepped by pushing it through without enough justification.
The rest of the mandate is still technically on the books, but according to the McKnight's article, the decision could significantly weaken the rule's future. Even though the rest of the mandate remains, this ruling casts doubt on how enforceable it really is.
And for senior living professionals, this is a reminder to stay flexible. Even though the rule's being challenged, the pressure to improve staffing levels isn't going away.
Right. Regulators, residents, and families all still expect high-quality care, and staffing is a huge part of that.
It's more important than ever to make sure staffing decisions are data-driven and resident-centered, not just compliance-focused.
Because at the end of the day, it's about making sure residents are cared for by people who have the time and the training to do the job well.
And that leads perfectly into our next story, also from McKnight's long-term care news, about a new study that could reshape how communities think about staffing.
Yeah, this one's really interesting. Researchers explored the idea of using case mix data to guide staffing decisions, basically tailoring staffing based on the specific care needs of residents rather than applying a blanket rule.
Right. Instead of saying every community needs X number of staff, the study looks at things like resident acuity, mobility, cognitive challenges, and medical complexity to figure out what staffing actually makes sense.
According to the McKnight's article, the researchers believe this model could help CMS refine its policies and offer a more balanced approach, something that's both resident-focused and operationally realistic.
And for communities, it could offer a smarter, more flexible way to make staffing decisions, one that accounts for the people you're serving, not just the paperwork.
Exactly. It's about getting the right people in the right roles to meet actual needs, not just meeting a number for the sake of compliance.
It's a promising direction, especially in light of all the ongoing challenges with workforce availability and funding.
Our third story this week also comes from McKnight's, and it's all about getting back to the basics with infection prevention.
Yeah, with CMS preparing to roll out new infection control guidance, infection preventionists across the country are taking proactive steps to shore up foundational practices.
We're talking hand hygiene, PPE protocols, environmental cleaning, those essential routines that can sometimes fade into the background, especially when staffing is tight or daily demands are high.
According to the McKnight's article, preventionists are doubling down on staff education, frequent audits, and reinforcing what works, all in anticipation of CMS tightening expectations.
And for those looking to get ahead, HealthCap's 2025 Regulatory Toolkit includes a comprehensive section on Enhanced Barrier Precautions. It lays out exactly how to implement and monitor these practices in real-world community settings.
That's right. The toolkit breaks down not only policy language, but also provides signage examples, implementation tips, and strategies for compliance, all designed to support teams in doing this well, not just checking boxes.
It's a great reminder that strong infection prevention doesn't have to be complicated, but it does have to be consistent.
So whether you're a DON, an administrator, or just someone passionate about resident safety, now's the time to refocus on the fundamentals, and that toolkit can be a big help.
All right, next up, we've got an important update from the CDC about COVID-19 vaccinations in long-term care.
Yeah, the CDC recently released new guidance on what it means to be up to date And it changes how we look at vaccination status for residents and staff.
Under the previous definition, someone could be considered up to date if they had completed the primary series and received the most recent booster they were eligible for, even if that booster was from an older formulation, like the bivalent dose from 2022.
But now, the CDC is saying that to be considered up to date, you need to have received the most recent COVID-19 vaccine available, which came out in the fall of 2023. Earlier doses no longer qualify.
So even if a resident got their booster last year or earlier, but didn't get the 2023 version, they're not counted as up to date anymore under this new guidance.
That could affect how communities report vaccination coverage, how they manage risk during outbreaks, and even how they educate families about protection and eligibility.
It's a change that simplifies tracking, but it does raise the bar in terms of what counts. Communities will need to revisit their records and make sure their internal definitions match the CDC's.
And with another fall vaccine expected later this year, now's the time to start thinking about how to handle consent, outreach, and documentation moving forward.
Our next story comes from McKnight's Senior Living and focuses on a new law in Florida that's adding a medical education component to the admissions process in assisted living.
Yeah, under the Emily Adkins Family Protection Act, communities in Florida are now required to provide new residents with a pamphlet that explains the risk factors and warning signs of blood clots, specifically venous thromboembolism, or VTE.
The law is named after a young woman who passed away from an undiagnosed blood clot, and her family pushed for greater awareness so others might be able to recognize the symptoms and act sooner.
According to McKnight's, the idea is to put this information directly in the hands of residents and families during the admissions process, not to turn them into medical professionals, but to raise awareness of a serious but often silent threat.
And for assisted living communities, this represents a subtle but important shift. It's about helping residents and families understand potential risks while also reinforcing the role that providers play in spotting early warning signs.
Exactly. While assisted living doesn't function like a hospital, residents still face health issues that require timely attention. This law encourages proactive education without placing a diagnostic burden on staff.
So if you're in Florida, you'll need to add this pamphlet to your admissions materials. But even outside the state, this is a great example of how simple education tools can lead to better awareness and potentially save lives.
It's another opportunity to strengthen the partnership between providers, residents, and families when it comes to health and wellness.
Now let's shift gears to a story from HHS.gov about a new initiative aimed at improving how we research and support aging in America.
Yeah, this one's called the Generation Gold Standard, and it's being launched by the NIH's National Institute on Aging. The goal is to raise the bar for how older adults are represented and supported in scientific research.
According to the announcement, this initiative will focus on creating stronger research practices that actually reflect the real-life diversity, needs, and challenges of older adults, including those living in senior communities.
That's important because historically, older adults, especially those over 85 or with multiple health conditions, have been underrepresented in clinical studies. But those are exactly the populations that most of our care systems serve.
Right. The Generation Gold Standard aims to close that gap by setting new expectations for how aging research is designed, who gets included, and how the results are applied in real-world care.
For senior living professionals, this is something to keep an eye on. Better research means better tools, better treatments, and more targeted support for residents.
And it also means a chance for communities to get involved, whether by participating in studies, shaping priorities, or applying new evidence-based practices as they emerge.
It's a long-term play, but one that could really reshape how we care for older adults in the years ahead.
And for our final story this week, we turn to McKnight's Home Care, where there's growing momentum in the private sector to support family caregivers.
Yeah, the article highlights a surge in programs and platforms designed to help family members who are stepping into caregiving roles, especially those caring for loved ones aging at home or in the community.
One standout example is TruAlta, a digital caregiver education platform. It's now supporting 90 caregiving portals across 33 states, offering practical guidance on things like dementia care, mobility assistance, and medication management.
And this isn't just about technology, it's about giving caregivers real tools to reduce burnout, improve outcomes, and feel more confident in the care they're providing.
According to McKnight's, employers, health plans, and even state governments are investing more heavily in caregiver support, recognizing that unpaid family caregivers are a critical part of the long-term care system.
For senior living communities, this shift is worth watching. As more resources flow toward family caregivers, we may see changes in how families engage with providers or in how long they delay moving a loved one into a community setting.
But it could also mean new opportunities to collaborate. Communities could partner with platforms like these to better support families before, during, and after a resident's time in care.
At the end of the day, whether someone is providing care at home or alongside a community team, they need support. And the more tools we can offer, the better the outcomes for everyone involved.
That wraps up this week's HealthCap Weekly Wrap.
Yeah, we covered everything from staffing rule shakeups and smarter infection control to resident education, vaccine updates, and the growing recognition of family caregivers.
As always, thanks for tuning in.
If you'd like more details on any of these stories, you can find the full weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
We'll see you next time.